My name is Dr. Ernest Van Ross, and I'm a consultant in rehabilitation medicine, and I specialize in amputee medicine. I've been doing this work for over 20 years.
I notice your left knee.
I see three types of cases. I see the new case where a decision has been made that someone needs an amputation, and the patient is referred to us. And we go through a full physical assessment, a psychological assessment, and we plan the rehabilitation of that person should they have an amputation, and following their amputation, so that we can try and restore as much possible function as quickly as possible for that person. And I see the patient with the team here at PACE Rehabilitation, and that includes the prosthetist, so that we can plan the best possible hardware they require, the physiotherapist, because movement of the joints, posture, balance and so forth are so important, and with an occupational therapist to allow the patient to achieve function within their home and with their work, and very, very importantly with our counsellor, because unless a patient has the right thoughts in their minds, there's a lot of research that shows that people who have the wrong beliefs, it's their personal beliefs about amputation being so devastating, about amputation leaving them disabled for life, and looking at things very negatively, will have a much worse result than someone who comes in with a realistic picture, not necessarily an unduly optimistic picture, but a realistic picture of what, with goals that they're trying to achieve. Now, not only do we work with the team at PACE, but we also have an interdisciplinary approach. So we will often work with orthopedic surgeons or vascular surgeons, and a lot of work with plastic surgeons, because producing the best possible amputation stump is, yes, it's a surgical science, but also it's a work of art. The second type of patient I would see is the patient who has long-standing problems. So these are complex patients, and often these patients have gone from centre to centre seeking a solution to their problems, and a full assessment and investigation, sometimes scanning of an amputation stump is important, working out the problem, and then finding a solution. Sometimes it's non-surgical, and sometimes the solution is surgical, and trying to find the correct solution and give the patient long-term advice is important. And the third type of patient I would see is usually a child born with a limb deficiency at birth, and it's trying to plot a strategy to allow that child to grow up with the best possible function. I always hope that when someone comes to PACE, it's an anticlimax, because they will feel relaxed, they have a cup of coffee, they have a chat to very friendly staff, and when they come in to see us over here, hopefully we're at their level in our approach.
But I've ordered this brace as well.
Here at a very human level, to find out what their problem is, and it's our job then to translate their problem into a medical problem, and to find a medical solution which is then translated back into an understandable form so that we communicate correctly. Following this assessment, we will always write a full report together with costings, so that the person is aware of what is involved. Once we get agreement from the person, we then go on to the third stage of treatment, where we try and implement our plans, and following that, we would like to always review the outcome of our treatment. The objectives of the team at PACE should be the objectives of the person. And by the objectives, I don't mean a comfortable prosthesis only. I want to know what their functional objectives are. What do they want to achieve? Do they just want to walk around the house? Are they planning to walk down the garden? Or do they intend to run or jog or play sport? How much does the person want to achieve? And I think our job is to assess the person and guide them as to realistic attainable objectives.
Yesterday,
Depending on the objectives that we identify, we set goals for the team, and by the team I mean now the person who's having the treatment is very much part of the team. The goals would include the type of prosthesis, the duration of use, the training period that the physiotherapist will then employ to try and improve the patient's fitness and durability of the amputation stump and the function, and the occupational therapist might advise modification to the house, to the sports equipment and so forth, so that we can then try and achieve what we started out to do. And that should be our objective. The second objective should be to maintain fitness and health of the person.